Okay, good morning, everyone. Welcome to our media and public briefing entitled From Manila to Geneva and in Every Community People Over Profits and Patents. Today is June 7, 2021. We have a press briefing by the Coalition for People's Right to Health, Pantay Bakuna, the Council for Health and Development, and the People's Health Movement Philippines, together with our civic media partners, Now You Know and Rappler Move PH. We are live on Facebook through these cross postings as well as on our respective Facebook pages. We'd like to welcome everyone to this discussion regarding the TRIPS waiver and the bigger goal of vaccine equity in this country. Okay, we'll be starting shortly. All right, so I hope everybody is ready. All right. Okay. So before we begin, we will have several speakers for today manifesting their support, manifesting their solidarity for the TRIPS waiver, especially on the Philippine context. And we will be discussing that in our first part for today. Okay. All right. So, what is the TRIPS waiver, and why are we always harping out about it? No? So, the Coalition for People's Right to Health, Pantay Bakuna, CHD, and the PHM Philippines have conducted a webinar last week. You can view that on our YouTube page, and we have conducted several Twitter rallies since the weekend, counting down to tomorrow's June 8 to 9 TRIPS Council meeting. So we conducted several Twitter rallies. We've conducted a total of three already, hoping to get more responses, not just from the general public, but also from uh, the Philippine representatives themselves. So that is something that we're still waiting on and hoping that we will have some form of support, no actual explicit and commitment for the Philippines to support the TRIPS waiver together with the 62 other countries who are proponents of the revised TRIPS waiver, which will be discussed tomorrow. So let's add a little more context to that. Okay. All right. So we'll start with some short updates regarding the Philippine situation. Okay. All right. So the Philippines has administered over 4 million doses, with over 1 million Filipinos fully vaccinated. So definitely, this is only just 1% of our total vaccine targets. The Philippines is mostly reliant on foreign vaccines. So we see here that the Philippines is mostly relying on at least six foreign vaccines with its emergency use authorization and another one with a compassionate special use permit. And we are still waiting for the majority of these vaccines to arrive so that the Philippines can fully roll out its vaccination program with an abundance of vaccines, which we still currently do not have. So vaccine inequity is really prevalent not just within countries but also among countries. So this is something that the government actually acknowledges, that 80% of the global supply has already been bought by the rich countries, but it's something that we are accepting. No? That's something that we seem to not be able to do anything about. We are rushing for more bilateral deals to loans so that we can procure more vaccines and even adding to our budgets for that. And we are heavily reliant as well on the COVAX deliveries, especially for Pfizer and AstraZeneca vaccines, and to the point that even the private sector has come in to facilitate the procurement of vaccines by having a tripartite arrangement with the public sector in procuring for their employees. So it seems that there's this helplessness amid this global demand and situation. So that brings us to something that renders some states and some countries hopefully not helpless by filing what we call the TRIPS waiver. So what is this, which we will be discussing today, and something that will be expounded on as well by our speakers with their statements. So the TRIPS is the WTO agreement on trade-related aspects of intellectual property rights. It was something that was negotiated in 1989 to 1990 by the fledgling World Trade Organization, but it was part of the General Agreements on Tariffs and Trade, or the GATT. It was signed by all member states on 15 April 1994, and it was binding by January 1, 1995, and enforced in the country no later than the year 2000. So this involves everything on copyrights, patents, intellectual property rights, that regarding anything that will be traded. And this includes medicines, and this includes health technologies. So it actually helps in increasing the prices of innovator drugs. Uh, Hence the increasing of the prices and really driving medical costs up, especially for very new drugs, especially now with COVID-19, that we have a lot of investigational drugs, and thus these tend to be more expensive. So there's an allotted time prior to generic use of medicines, according to the the TRIPS, and this is 20 to 25 years, but at a minimum of 20 years before they can be used for generics. So the Doha Declaration in 2001 attempted to change some of these things by promoting additional TRIPS flexibilities. It doesn't try to change really TRIPS, but it tried to make sure that it was a little flexible. And that was where it promoted things like compulsory licensing or parallel importation. And compulsory licensing, for example, means that a generic production will be initiated by the state, but eventually they will have to compensate the innovator company who holds the patents. So what about for COVID-19? What about in one of the biggest public health crisis in recent history? So there was a South African and Indian proposal that was pushed in November 2020 to waive patent enforcement for COVID-19 technologies for vaccines, medicines, and diagnostics. And this kept being deferred despite being filed at the WTO in November. It kept being deferred on its decision from December to March, and then now we'll be having a formal meeting of the TRIPS Council on June 8 and 9, 2021, which is tomorrow. And the WTO decides by consensus. It doesn't decide by voting, and thus it really needs a consensus of countries for this to be passed. But it was rejected outright initially by the US, the European Union, Canada, Australia, Japan, Switzerland, and Brazil. The Philippines, however, actually signified agreement according to the tracker of MSF, but it's really the rejection that was more prominent by these Western countries that is really prominent with regards to discussions of the TRIPS waiver. So, yeah, since then, the proposal has since been revised. And again, I mentioned it was South Africa and India. So now there's the support of 60 other countries, namely Bolivia, Egypt, Eswatini, Fiji, Indonesia, Kenya, Maldives, Mozambique, Mongolia, Namibia, Pakistan, Vanuatu, and Venezuela and Zimbabwe, as well as the other countries in the African group and the least developed countries. So this came for a total of 62 countries supporting, as well as additional states supported by it. So it is a waiving of sections in the TRIPS, especially for health products and technologies, anything for for the prevention, treatment, and containment of COVID-19. So there is a definite time for this. It is enforceable for 3 years and then will be on review annually. So this is in the revised proposal. And it acknowledges the existence of the variants, the global need for access, and the importance of diverse production and supply. So all of a sudden, in early May, we saw a reversal in the stance of some countries, such as the United States, who suddenly backed the vaccine waiver specifically. for in terms of the proposal. And China is also supporting the IP waiver, as well as Russia, and Mexico is now also actually also supporting it. So we are seeing some reversals in some countries, but the European Union is still one of the biggest adversaries of the passage of this proposal. But even the World Health Organization, even the Holy See, even the Vatican actually supports this major uh, proposal. So it has changed. No, we're seeing some changes in terms of the world, in how these countries are acting. And it says here that the Philippines is a general supporter, but as we will see, that is something that we have yet to actually have any hard evidence of. So I mentioned earlier we have some inequalities in vaccine orders. So I will not. So it is an advantage for countries who can purchase them, and we see some Western countries have purchased well more over than what their population need. And while other countries, despite not being able to purchase, have some vaccine production, Cuba, Malaysia, Indonesia, Thailand, they have been able to secure vaccination deals with other countries, for example. And the Philippines lacks local production. This is something that unfortunately we are not like our neighbors. The Philippines used to have vaccine production in creating BCG vaccines as well as anti-cobra venom, but unfortunately that facility became dilapidated and was no longer rehabilitated at all, except when the land was sold to a major mall in the south. But eventually it is now being refurbished into a storage facility, but nowhere near the legacy of a vaccine institute that it once was. So we have a lot of social media campaigns from different groups arguing for this, the TRIPS waiver. But the more important thing that we need to see in our country is still yet to materialize. Again, tomorrow will be the meeting, and we actually don't know what our Philippine Permanent Mission to the World Trade Organization will do. Will they support it? Will they be uh, agnostic about it? No, and we actually haven't heard from much of these agencies who are governing our COVID-19 response and should be involved in the matter of the TRIPS waiver, specifically the Department of Trade and Industry and its Intellectual Property Office, the Department of Health, and the Department of Foreign Affairs, which handles the permanent mission. So perhaps one major development since we started our campaign is seeing what the Philippines actually mentioned in the World Health, the recently concluded World Health Assembly on June 1, that the Philippines actually mentioned in its World Health Assembly statement that they fully support um, some changes in intellectual property, but also through applying what we call TRIPS flexibilities, as I mentioned earlier, through not really changing the law or waiving the patents, but really just having some flexibilities. It is the first time the DOH or through the World Health Assembly actually mentioned removing barriers in intellectual property rules and recognizing that waiving patents is one of the many actions necessary to solve the critical shortages of vaccines and supplies for COVID-19. So this is a development. We are starting to see some terms being used by government agencies, but it's not actually an explicit support yet of the TRIPS waiver. That is still something we have yet to see. On the other hand, which will be discussed also later, we have seen our allies in Congress file a House Resolution 1831, a resolution urging the Philippine government to sign and unconditionally support the trade-related aspects of intellectual property rights, or the TRIPS waiver, at the World Trade Organization for the prevention, containment, and the treatment of COVID-19. Signed by Representatives Rosas, Zarate, Puliamat, Gaite, Castro, and Elago, which was filed last June 2, 2021, before the session of the Congress concluded. So this will be discussed when the third regular session begins, and hopefully this may be a sign of some improvement towards the TRIPS waiver. Okay. So is the Philippines still wavering on the TRIPS waiver? And that is something we hope to answer today. All right. So from now, we'll be starting our the support statements for the TRIPS waiver. We will be starting first with okay, right. So I'll be starting myself on behalf of the Coalition for People's Right to Health. That's something that we will begin with before we continue with our other speakers. So the Coalition for People's Right to Health has released a statement since June 2 uh, on the TRIPS waiver entitled "Putting People Over Profit and Patents: Equity of Access is a Right to Health." So this is a statement of the Coalition for People's Right to Health supporting the TRIPS waiver for COVID-19 vaccines, medicines, and technologies. Okay. So yeah, I will read the statement. Okay, so in a few days or tomorrow, the TRIPS Council of the World Trade Organization will reconvene to discuss a revised proposal filed by the nations of South Africa, India, and 60 other countries to waive intellectual property rights for COVID-19 technologies that prevent, treat, and contain the pandemic. This seeks to temporarily amend the 1994 WTO agreement on the TRIPS related aspects of intellectual property rights, which dictates rules on the patents and trade of goods, including medicines and vaccines. In the middle of one of the biggest health and economic crises in recent history, corporate interest and profit are still a major barrier to health equity. The development of vaccines, medicines, and diagnostic tools are still determined by market viability instead of fulfilling the people's right to health, with the powerful more determined to protect the former rather than the latter. Under TRIPS, this right to profit will be protected for at least 20 years. Apart from the centralization of wealth in the hands of big manufacturers, the access of medical goods has really gravitated towards those who can willingly afford it, and this comprises the richer countries of North America and Europe, who have already purchased around 80% of the global supply, despite having more doses than what their population actually needs. The rest of the world now either has to pool its resources for the remaining vaccines or look to their own manufacturing capabilities to produce its own health needs towards the goal of herd immunity, which we don't know when it will attain. The TRIPS waiver is thus an attempt to put people over patents and improve vaccine equity on a global scale. Countries from South Africa, Asia, and the Pacific have called for a change in the status quo that puts premiums on intellectual property rights of medical tools instead of making it available to those who need it most. The Philippine government unfortunately remains remarkably silent on the issue. DTI Secretary Ramon Lopez actually showed pessimism on the chances of the TRIPS waiver's passage given the lack of consensus at the WTO, preferring instead to utilize compulsory licensing. At present, the Philippines has been dependent on at least 4 to 5 foreign vaccines in its mass immunization campaign, vastly limiting the rollout to regions increasingly affected by COVID-19. While the Philippines lacks its own infrastructure and capacity, a TRIPS exemption may actually be a first step to incentivizing and revitalizing national industrialization apart from widening access through decentralized negotiations. CPRH begs the question on why the Philippines has still not supported the TRIPS waiver explicitly, despite its potential benefits and the goal of global solidarity amid a pandemic. Vaccine czar Galvez has repeatedly echoed the rhetoric of richer countries racking up most of the global supply, but with little to no discourse on questioning why that is, which is something the TRIPS waiver essentially dares to answer. CPRH believes that it is high time for the country to finally break its silence and stand with the countries demanding vaccine and health equity as soon as possible. CPRH calls on the DOH, the DFA, and more importantly, the DTI, as well as those running the pandemic response, the IATF and the NTF, to unconditionally support the TRIPS waiver both publicly and through its permanent representative to the World Trade Organization, Ambassador Manuel Tihanki. As disease and inequity spread even more rampantly in our country, we cannot afford to be idly silent. Advancing the right to health amid the pandemic entails asserting people over profit and people over patents in Geneva, in Manila, and in every community. So this has been the statement of the Coalition for People's Right to Health. And now we will move on to the other organizations we have here today declaring their solidarity towards the TRIPS waiver and the larger goal of vaccine and health equity in our country. So our next speaker is from the UP Diliman COVID-19 Task Force, who has actually released a statement on the vaccine TRIPS waiver, sorry, the TRIPS waiver way earlier than any of us. We have for today the Vice Chancellor for Student Affairs, Professor Luce Sunido, who is also an assistant professor at the Department of English and Comparative Literature. So welcome, Professor Sunido, and thank you for sharing the stance of the UP Diliman COVID-19 Task Force.
Maraming salamat, Doc Josh. Maraming salamat for having me here. We released the statement early in June. I think it was around June 4. But I guess before reading the statement, just a quick intro on the COVID-19 Task Force, which released this statement for UP Diliman. So the COVID-19 Task Force of UP Diliman is actually a multi- and interdisciplinary task force. It has representatives from the University Health Service, faculty from the College of Science, the lab manager of the Philippine Genome Center, members of the UPD administration, of course, and various other faculty and researchers from the arts and humanities, medical anthropology, law, information technology, etc. This task force was convened by Chancellor Fidel Nemenzo last March 2020, right at the onset of the COVID-19 pandemic. And ever since, it has met once a week without fail, to review policies, consult on health protocols and guidelines, and of course, monitor our isolation facilities. We have two in UP Diliman, Silungang Molave, which is under the University Health Service, or UHS, and the COVID Task Force. But we also have Camia Residence Hall, or Hope 7 now, which we set up in partnership with the Philippine Red Cross and the QCLGU. And of course, our UPQC vaccination site, our Bakunahan sa Diliman, which we set up in the College of Human Kinetics, yung malaking gym, where we have become really all too acquainted with these difficulties with vaccine shortage and vaccine inequality. And so we released this statement early in June. Please allow me to read it to you. UP Diliman COVID Task Force calls for suspension of intellectual property rules on COVID vaccines and treatments. We, members of the University of the Philippines Diliman COVID-19 Task Force and other members of the UPD community, join the growing number of people worldwide who call for the temporary suspension of patent rights and intellectual property rules that hinder the Philippines and other developing countries from mass-producing COVID-19 vaccines to save lives and protect their people from the ravages of the pandemic. In particular, we support the proposals of India, South Africa, and other developing country governments to temporarily waive the relevant provisions under the trade-related aspects of intellectual property rights, or TRIPS agreement, under the World Trade Organization. In the Philippines alone, the number of COVID-19 cases has breached the 1 million mark. In recent weeks, on average, around 5,000 to 8,000 still get infected by the virus every day. Nearly 200 die daily. Unemployment and underemployment figures have worsened in the context of the pandemic. Today, 1 in 10 Filipinos remain unemployed or underemployed. We urgently need rapid nationwide immunization and immediate provision of life-saving treatment to as many people as possible. Key to making this happen are an adequate and affordable supply of vaccines, drug tests, ventilators, masks, drugs, and other products needed for the prevention and treatment of COVID-19. And no less important, the strong political will needed for the government to push for vaccine sufficiency and equity, and a speedy and efficient vaccine rollout. Instead, what we witness today are rampant vaccine inequality globally and inefficiencies in the national vaccine rollout. According to the World Health Organization, over 80% of the 1.16 billion doses that have been administered benefited rich and middle-income countries, while only 0.3% have trickled to developing countries like the Philippines. This is no accident. Rich and powerful countries are hoarding much of the available vaccines, and big pharmaceuticals are monopolizing the technology needed for developing countries to produce the vaccines for their own people. With technology transfer and their existing resources and expertise, many drug companies in the Philippines and other developing countries can potentially cover the shortfall that giant drug companies are unable to provide. They can produce millions of doses of additional vaccines and help make it possible to inoculate 60% of the world this year and all those who want a vaccine by the end of 2022. But they are being prevented or hampered from doing so by the intellectual property provisions in the World Trade Organization's TRIPS agreement. By refusing to sign a waiver of patent monopolies for the vaccines, big pharmaceuticals stand to profit the most from exclusive production and distribution rights to COVID-19 vaccines, even as they struggle to keep up with the global demand. As a result, a humanitarian disaster is unfolding before our very eyes. In the Philippines and other countries like India, only a tiny fraction of the population have been inoculated, leading to untold deaths and suffering that could have been largely prevented. The window for achieving herd immunity also closes rapidly as more and more variants of the virus emerge amid the slow rollouts. Unless the deficit in COVID 19 vaccines and treatments is covered, this disaster is bound to worsen. At the rate vaccines are being produced, majority of the population of developing countries, such as the Philippines, will not be inoculated until at the latest the end of 2024. By then, inoculation against COVID-19 would have been rendered outdated and moot. The economic collapse would have starved and sentenced thousands, and the death tolls would have rung too many times than should be conscionable to anyone who has any ability at all to intervene and prevent this from happening. This is why we join the call for waiving the intellectual property rules immediately so that we can increase the supply of COVID 19 vaccines and other drugs worldwide, and in so doing, save more lives, ease suffering, and end the pandemic once and for all. Today, confronted with an unprecedented global health and economic emergency, we encourage also our fellow academics, including those in other universities, to join us in urging the Philippine government to adopt this clarion call to the international community. The mantra, "no one is safe until everyone is safe," resonates now more than ever, underscoring the urgent need for global solidarity and cooperation. Maraming salamat.
Okay, maraming salamat po, Professor Sunido. Thank you to the UP Diliman COVID-19 Task Force for your support on the TRIPS waiver and your proactive measures, no, in making sure that COVID-19 is really something that will be addressed at the level of the community and through public demand. Before you leave, I understand that you won't be able to stay for our open forum. May we ask if there are anything that the UP Diliman Task Force needs the public support for with regards to the TRIPS waiver, as well as include in increasing the need for COVID-19 response from all sectors, and how may we help, no, in probably even expanding the call for the TRIPS waiver to the larger university system, no, to other campuses as well.
Yeah, I think it's a matter of keeping up this. It's more than a political campaign. No, it's more than just a call. It's really also a matter of educating a lot of people on the role of the TRIPS waiver in the vaccine rollout, how it enters into the whole equation of resolving the issues of the pandemic. And so it is as much a matter of education as it is a matter of dissemination. There are those two are inherently linked in this. And so we appreciate, of course, these kinds of efforts by the CPRH to have this kind of public forum, because we do need to be it's also a game of stamina. We need to consistently and constantly call for this waiver. Otherwise, if not a lot of people know about it, much less understand again its role in resolving this pandemic, then it will fall through the cracks. And so I think the key also is consistency, no, and constant campaigning for this. And of course, again, just bringing it in as many avenues, through as many avenues as we can, to as many people as we can. So we do hope more universities will also pick up on the call. We will see if we can make any headway, into collaborating with more universities for things like joint statements, etc. We have Ateneo, for example, that has also opened up many schools, really, not just Ateneo, many schools, including secondary and elementary schools, no, have actually given, they have been allocated already, as vaccination sites. So the education sector is participating a lot in the vaccination program of the national government, and so perhaps through these channels, coming to be aware of the challenges again of the vaccination rollout, um, we would be able to reach more people and make them understand again the necessity of calling for the TRIPS waiver, and hopefully again gain solidarity, or strengthen rather solidarity among all education sectors. And in that, it will have a multiplier effect, and hopefully with our faculty and students, and we will come out of it better educated, better informed, and of course readier to keep fighting for, calling for this waiver. Ayun.
All right, sige. Thank you, Professor Sinito. So again, that was Professor Luce Sinito, the Vice Chancellor for Student Affairs of the UP Diliman, and also a part of its COVID-19 task force. So thank you very much for the time and support and solidarity for the TRIPS waiver. Okay, so from there, we will now move on after that speaker. We'll now go to uh, a medical student. So we have next Mr. Simon Philip Sacramento. He is the Secretary General of the Philippine Medical Students Association, UERM, again, and also a medical student at the UERM. So thank you very much for your time. From PMSA UERM, Dr. Sacramento.
Hi, Doctor San. Anyway, so I'm here to give our stances on the TRIPS waiver, as well as to push the specific agenda of self-sufficient vaccine manufacturing and research. So, as has been discussed, the TRIPS agreement was created to enforce standards on intellectual property. That is, any creation is in theory protected from things like intellectual property theft, and it enforces standards for international trade. Now, this is the working theory behind it. It incentivizes creative work, it enforces trades. But this has been criticized time and time again for enforcing European and US based standards to the rest of the world, and for facilitating unequal trade agreements. So many people would argue that it's a profit-oriented trade model, but that's a very big can of worms that should be discussed in a separate forum. But now a specific issue has emerged, a specific issue of public interest. So this is the COVID-19 pandemic and the vaccines that will supposedly end it. So the TRIPS agreement the TRIPS agreement is preventing the manufacturing of vaccines that are patented because they're being protected. And PMSA supports the TRIPS waiver for the COVID-19 vaccines and related technologies bec- because we believe that this will lead to the faster ending of the pandemic and the faster recovery, not just of the Philippines but of the whole world. Now, pharmaceutical companies argue that it must be maintained, your TRIPS, so that they can recuperate their losses to research and development, as well as incentivize the researchers that produce these vaccines. However, we assert that this is not a matter of profit. This is not a discussion of cost. This is not a discussion of money, but it's a discussion of public interest and the common good of humanity, not just a single country, but humanity itself. If you're talking about recuperation, it will come when economies reopen and when the workers of the world, when your workforce, when the populations of countries are actually vaccinated against the virus, and and we can resume economic activity and operations. Now, with alongside our support for this TRIPS waiver as pushed by many countries, we also want to acknowledge our support for local vaccine manufacturing and research. The experts exist in the Philippines. There are many brilliant minds in this country. And we have some facilities, such as the RITM, although as it has been discussed, some of our facilities have become decrepit and unfunded, such as your current festival mall in Alabang. But something can be done because the pandemic has put to the forefront the issue of equitable public health access, which includes vaccine. There has been stimulated discussion because of what has happened. Your National Task Force Against COVID-19 chief has supported the idea of creating vaccines for the populace locally. And now in Congress, they're pushing for the Virology Science and Technology Institute of the Philippines to be established. So the discourse is happening. And we fully support what is happening, that discourse. This will strengthen our public health system because currently our ITM only manufactures vaccines for tuberculosis as well as for snake venom. We could do so much more. We could make it so much more accessible for this pandemic and other future emergencies of public health. However, alongside this support, we assert that we must not let the discussion be dominated by private interests. We must not let it be dominated by conversations of profit and investments, as vaccine production and public health is not an enterprise for profit. As it has been treated like that, we can see now the disaster that we are in, and we cannot allow that to happen in our country when the time comes that we are producing our own vaccines. So yes, we support vaccine manufacturing and research in the country, but it must not be a profit-oriented endeavor. It must be for the public good. Now, as medical students, as a member of the Philippine Medical Students Association, we express our unconditional support for the waiving of the TRIPS agreement with regards to COVID-19 vaccines and technologies. We support the establishment of institutions that strengthen the research, development, and production of vaccines and other related technologies for the sake of public health, as long as it's not dominated by the profit motive. As the future physicians, scientists, and researchers of this country, we take this stand and we fully support what is being held in this forum today.
All right, thank you very much, Dr. Sacramento. So sorry, just to correct, he is the Vice President of the PMSA UARM. So thank you very much to our future doctors, our future uh, uh, parts, no, and who will eventually lead our future leaders in the health system. Dr. Julie Cagiat, the spokesperson of Cure COVID, or the citizens' urgent response to end COVID-19.
Okay, thank you, Doc Josh. In behalf of Citizens Urgent Response to End COVID-19 or Cure COVID, we are one in supporting the call of Council for Health Development, Coalition for People's Right to Health, by Bantay Bakuna and the People's Health Movement Philippines to support the TRIPS waiver for COVID-19 vaccines and technologies. As citizens, as a short introduction, Cure COVID is an initiative of different people's organizations, sectoral groups, experts, and advocates in response to the COVID-19 problem, its effects on the health and livelihood of different communities, and pushing for a comprehensive, effective, humane, and people-centered response to the pandemic. In the light also of Cure COVID stands for free, safe, voluntary vaccination and its equitable distribution, we support the call for the Philippine government to immediately support the TRIPS waiver for COVID-19 vaccines and technologies. We also have our public forums, which we do regularly, almost weekly. And last week, one of our the topics that we had was about vaccination and the control of the pharmaceutical companies over the vaccines and how it is distributed, how it is priced, and of course the government's different response towards these vaccination programs in different countries. Um, Cure COVID stems from the need to increase vaccine supply for poor countries and for their people, the Philippines included, without further burying them in debt and restrictive patent requirements, especially during this public health emergency. This has undermined further the pre-existing institutional weaknesses, including in health, food, and procurement systems, and highlighted a lack of access to quality, accessible, and affordable healthcare for all. It has also been used by governments and business enterprises to lessen international rights commitments. Article 2, Section 15 of the Philippine Constitution states that the state shall protect and promote the right to health of the people and instill health consciousness among them. As a right and social service for the public good, Filipinos should not be deprived of vaccination on account of profit. There is a need to reiterate that health is a state obligation that needs to be prioritized. It is not a charity. It's not it's not a commodity that must be prioritized for profit, but rather as a service delivery. It's a delivery for public service that must be enjoyed by all Filipino people. At present, there have been about 9.3 million vaccines delivered to the country, with only 1.2 million completed doses and almost 4 million receiving the first dose. This represents only 1.11% and 3.65% of the population. At the rate that we are going, the vaccinations are going, 144,000 of doses per day will not be able to reach herd immunity by the end of this year, which requires 350 to 500,000 jabs daily. Um, we know of the Philippines' slow vaccine rollout, and it is reflective of the poor healthcare system, the planning, the implementation, and overall leadership. We in the field, no, especially the sectoral groups that are with us, the organizers that we know who are members of Cure COVID, they have a lot of stories to tell. The low vaccine confidence of the Filipinos, those who do not want to be vaccinated, or those who want to be vaccinated but are not, it's not easy for them to register at the local level of the local government units. There's still poor no, information dissemination about the vaccination program. You can see them in social media, but of course, it doesn't mean that while the Department of Health is communicating or are communicating this information to the public, they are easily absorbed and understood by the Filipino people. We do not actively see health workers going to the ground proactively promoting the vaccine program. We know since last year that there have been illegal entries of vaccines. Even the president himself has admitted to that. But the accountability still, we don't know yet what happened to the accountability. We know that the priority lines are being, no, they are being jumped at. They are not being followed. And most of the time, there was even a student that I was able to talk to, and they were saying that we have the priority list, of course, because the supply is not enough. But indeed, this is a big question. And at the global level, ensuring fair, free, and equal access globally, we believe facilitates vaccine confidence and boosts the public trust in health systems. So that is why we are supporting this call for the TRIPS waiver. Vaccination can help control the spread of the virus, but of course, part of our call is also building an effective public healthcare system, a robust economy, and food self-sufficiency, and people's participation in governance are also important and strategic considerations. And finally, we must we reiterate our call that the states must engage in global mutual cooperation, not only as a reaction to the present global calamity, but must start to and must constantly challenge the monopoly of big pharmaceuticals on medicines and essential technology. This is if they are seriously bent on protecting and promoting the people's right to health. So this is all for Cure COVID, and thank you very much. Good morning to everyone.
Okay, thank you very much, Dr. Kaget. Sorry for the technical difficulties. So, as mentioned, that was Dr. Julie Kaget, the spokesperson for Citizens Urgent Response to End COVID-19 or Cure COVID. So, thank you very much for giving us the perspective for those in the communities and for many of us who need to be in solidarity with moves like this. Okay, so all right, before we proceed, I just want to go back to our a statement of support as well from Oxfam Philippines and the People's Vaccine Alliance.
Governments have given drug companies billions of dollars to develop a COVID-19 vaccine. Yet, millions of people won't be able to access or afford the vaccine because these same companies have complete control over the price. We need a vaccine that's free and available to everyone, everywhere. Where you were born and how much money you have shouldn't determine whether you live or die. It's time for a people's vaccine.
Okay, all right. So that is from the People's Vaccine Alliance, especially regarding their campaign, no, for the COVID-19 vaccines and TRIPS waiver. So
Governments have given
just a short addition to that. So it is a campaign currently that we're seeing that it is very unfair, you know, especially with regards to the support for the TRIPS waiver, that we are seeing really the profits really over people, and that is something that is cannot be correct, you know, in the middle, and can't be ethical and or acceptable in the middle of this pandemic, you know. And we have seen really the rise of profits, especially with nine new billionaires, no, according to a study from Oxfam, that there are nine new billionaires amid this pandemic. No, we have seen those in Moderna, in BioNTech, and even in CanSino Biologics from China, who are really racking up billions. No, their net worths are now over $1 billion because of the profits from this COVID-19 vaccine. And this is something that is increasingly unfair, where most people are still struggling, not to even have access to basic vaccination services, while those who are creating it, you know, are really concentrating it among the privileged and the wealthy. So it's not, uh, you know, it's not ethical in the middle of this public health and economic crisis that this is becoming the new reality. So according to a statement, no, by Oxfam Europe, these billionaires are the human face of huge profits that many pharmaceutical corporations are making. So these vaccines were funded by public money, as the presentation showed earlier, and thus it should be first and foremost a global public good and not a private profit opportunity. So Oxfam Philippines is part of the People's Vaccine Alliance that is supporting the local, regional, and global campaigns that call for commitment to the TRIPS waiver. So thank you very much to our partners who have been supportive, no, towards our campaign, to making the government realize, no, its role towards vaccine equity. Okay, so our next speaker is Representative Carlos Isagani Zarate, a representative of the Bayan Muna Party List at the 18th Congress of the Philippines, and a sponsor of the House Resolution 1831, which we mentioned earlier, is urging the government to unconditionally support the TRIPS waiver. So good morning, Congressman Zarate.
Morning, magandang umaga. Maraming salamat, Doc Jos, at maraming salamat sa ating mga kasama sa umagang ito. Dito sa ating pagpapahayag ng pagsuporta doon sa waiver ng TRIPS, no? Dahil nga sa gaganapin na pagpupulong meeting bukas ng WTO on TRIPS. Yes, as earlier mentioned by Doc Jos, the Makabayan Bloc in the House of Representatives filed House Resolution number 1831 that calls for the Philippine government, the Duterte administration, to sign unconditionally and support and unconditionally support the trade-related aspects of intellectual property rights, or TRIPS waiver, at the WTO meeting for the prevention, containment, and treatment of COVID-19. Previous speakers have already stated the various reasons why we have to support this waiver of the TRIPS. But specifically, especially in Congress, we were alarmed because in the several briefings that we had previously, we already raised this issue, but it appears that our uh, officials, no, especially in the IATF and DOH, are not so keen, no, in supporting this TRIPS waiver. So through this resolution, uh, we hope that as we resume our session for the third regular session after the State of the Nation address, this resolution will be adopted by the House, and the House, including the Senate, will see the importance, no, especially in this severe crisis that we are still suffering from now, crisis that is being aggravated by this COVID-19 pandemic, you know. And as mentioned by Doc Josh, no, and the other speakers, pandemic profiteering is now very apparent, no, in the manufacture of vaccines, no, from China to Europe to the Americas. So uh, it appears now that, as in the past, it is still true now, vaccination or medicine is a major uh, source, no, of wealth for a few, no, especially the big pharma. Health, especially, is a source of wealth, big profits for uh, big countries, big pharma. So this is the time that I think people should really assert, no? Because this pandemic is hitting hard the poor, the very poor, not only in the poor countries, but more especially the poor of the world. And uh, I think that it is a good development that other countries are now uh, also supporting this TRIPS waiver. But again, on top of just a waiver to these TRIPS provisions, one lesson that we have learned in this pandemic, this one, I think this is the first time in our lifetime that we are suffering this kind of health emergency, is that um, we have to develop also our own local pharmaceutical industry. We cannot just rely on big uh, developed countries or first world countries to provide us with this much needed medicine, much needed vaccine in times of pandemic. COVID-19 will not be the first nor will be the last pandemic that we will be experiencing, as the experts say. So it's very ironic that other countries, especially big countries in Europe, as in the US, they are now starting to inoculate or vaccinate even their youngs. No? But here in the Philippines, for example, only today we will be rolling out the vaccination for our frontline workers, employees, serving in the front line. But we know for the fact that the rollout of vaccine in the country is in a snail pace. Hindi pa nga natin na inoculate even our elderly people in many provinces, cities, or regions. Nag-aantay pa rin ang marami, no? Ng mga elderly people, mga health workers, and even yung people with comorbidities. So once again, we in the Makabayan Bloc in Congress supports this initiative, calling for the waiver of trade-related aspects of intellectual property rights in the WTO, and we call on the Duterte administration to unconditionally support this. And we also call our counterpart, not only in the House, but as well as in the Senate, to also pass resolutions that supports this call for waiver and unconditional support. Maraming salamat. Magandang umaga po sa ating lahat.
Okay, maraming salamat. Thank you very much po, Representative Kaloy Zarate of Bayan Muna. Just want to ask lang po, kung has there been any response already to the House resolution since being filed po?
Yes, because we filed this just before we go on CNJ adjournment. No? While some of our colleagues, even in the majority, express their willingness to support this resolution, this will probably be formally tackled once we resume our third regular session, no, after the SONA. So we will do our best to campaign for more co-authorship of this resolution. But I think it is very important also that we do a similar campaign in the Senate, as well as I think it's very important to also get to for the local governments to be involved in this, because they are also in the front line in our vaccination rollout. No? So there are leagues of cities, leagues of municipalities, leagues of provinces that we can also tap to pass similar resolutions for the national government to really get the feel on the ground, especially in this call for big pharma, big countries to waive these provisions on TRIPS.
All right, so thank you very much po for the Makabayan Bloc for filing House Resolution 1831, and we will look eagerly po to the updates and what we can achieve, no, through our lobbying, especially as concerned citizens and concerned communities, no, in strengthening the right to health. So maraming salamat po, Congressman Zarate.
You're welcome. Salamat.
Okay po, so now we will proceed to our esteemed speaker from the People's Health Movement. So now we have the head of the Trade and Health Thematic Circle of the People's Health Movement, and also a scholar emeritus of the School of Public Health and Human Biosciences from La Trobe University in Melbourne. So he was once also my teacher on global health. Thank you very much, Dr. David Legg, for sharing your time with us and strengthening our solidarity together towards a stronger People's Health Movement for the TRIPS Waiver.
Thank you, Dr. Josh. It's a great privilege to be with you, and I think this is a terrific initiative that you're running. I do hope the Philippines expresses the support for the waiver at the meeting tomorrow. The People's Health Movement is let me just show you one or two things. Here, the People's Health Movement is a international movement of progressive forces in health around the world, and we've been pushing for, in many of the different countries where PHM operates, we've been pushing for the waiver since it was announced in November last year. If you need to know more about PHM, there's the charter of the People's Health Movement, which makes it clear that the health of people is not a technical issue. It is tied to the way in which societies work, and indeed the way the global geopolitics works. So in that context, I think it's useful to think about the waiver in terms of both the position of the rich countries, in particularly Europe, and the position of pharma. The rich countries started out by refusing to join what was called the CTAP, the proposal for sharing the technology about COVID technologies, going along with pharma, which also refused to have anything to do with it. And instead we got something called the accelerator, which was deliberately taken out of WHO and run by the large global health organizations, which are not accountable to anyone, and including the Gates and the Wellcome philanthropies, which is a way of saying that the developing countries were explicitly cut out from the governance of the response to COVID in particular in terms of developing these technologies. The vaccine nationalism that's been spoken about was sort of sailing along quite nicely until South Africa and India landed their waiver proposal, and suddenly the rich countries realised that they had been shooting themselves in the foot, so to speak, partly because they were losing a lot of credit in the developing countries because of their vaccine nationalism, but also because if the longer the pandemic proceeds, the more likely it is there'll be more variants, and variants which are not responsive to existing vaccines, and that the pandemic will proceed. The stupidity of this approach is sort of reflected in what's called the COVAX initiative, which was the sort of a charitable approach to buying up vaccines for developing countries. First of all, the COVAX has been completely underfunded. But secondly, there was a commitment made that it would only cover 20% of the populations of those countries participating. So the 20% is nowhere near anything like herd immunity. So from the beginning, the big players in global health governance were happy to contemplate the pandemic proceeding on without actually effectively arresting it. And it's in this context that the role of Big Pharma needs to be seen, because you need to recall that the TRIPS agreement, which was negotiated, as Josh has said, from 1986 to 1994, was led by Pfizer. Pfizer was the leading force behind the development of the TRIPS agreement. And it is the TRIPS agreement which has effectively closed down vaccine production capacity in so many developing countries, because by putting tight intellectual property requirements and centralizing production in the rich world, it is very hard to maintain those local, without government support, local pharmaceutical capacity. So the issue of local production is a major ball in play at this time. The way in which pharma has approached the COVID has been quite blatant. First of all, completely refused to participate in the so-called CTAP initiative. In fact, sneered at the idea that they would share their technologies. Secondly, forcing the COVAX people to restrict their donations of supposedly donations, if they get enough money, to the 20% rather than the 70% which is needed. Thirdly, refusing to strong opposition to the waiver because they're so keen to maintain their pricing power. But the most egregious part of it has been the deliberate control of supply, that the actual production has been of COVID vaccines has in many respects been deliberately constrained. So a major vaccine producer in Bangladesh reports that he wrote to all of the big US manufacturers, asking them, telling them that he had a capacity in Bangladesh to produce the vaccines, and no, he didn't even get any replies to his emails. So the significance of the TRIPS waiver is not just that it might facilitate increased production, because there are other factors which have to come in, like a technical know-how and access to cell lines and so forth, but undoubtedly it would make it easier to negotiate those additional requirements. But the waiver also challenges the intellectual property regime, which has brought us to this stage. And getting back then to my earlier comment about the contradictions between the low and middle income countries and the rich countries, is being brought out very clearly because in terms of whether they support the extreme intellectual property regime that the TRIPS agreement and various TRIPS plus agreements have implemented, or whether they are willing to move towards a more relaxed approach to intellectual property, so that local production can be encouraged, so that we don't have these very thin global supply chains, but we have adequate support for the production of medicines and vaccines around the world, including in cases of emergency. So from the People's Health Movement globally and the People's Health Movement in Southeast Asia and the Pacific more generally, I do bring greetings. I bring greetings of solidarity, and I do also take away some level of inspiration about the work you're doing. And thanks again for having me to participate today.
All right, thank you very much, Dr. Leg. So we'll be proceeding after this to our open forum, but before that, Dr. Leg, could we ask about the what we call the European counter proposal that we're hearing now regarding the TRIPS waiver?
Well, as the high-income countries started to realise that they had, as I say, shot themselves in the foot, both in terms of vaccine diplomacy and in terms of the risk of variants, all sorts of proposals have come up. The World Bank has come up with increased lending money so that more countries will be in hoc to the bank in order to pay for their own vaccines. Europe has come up with or the Germans have come up with the mRNA production hub. That's a good 5-year program. It's not going to solve anything for COVID. The WTO, the chairperson of the General Secretary of the WTO, has come up with her so-called third way, which is really about asking pharma to be nice and to share its trade secrets. It's completely insufficient. The pharma says pharma has been opposing the use of TRIPS flexibilities, opposing the use of compulsory licensing and parallel importing for 30 years, but they are now saying that it's okay, that parallel importing and compulsory licensing could work. But if you look at one of the TRIPS flexibilities, it's compulsory licensing for export, which was written into the TRIPS agreement after the Doha summit in 2001. It is impossible to use. So Canada tried to export AIDS HIV drugs to Rwanda under this provision for compulsory license for export, and it took 6 months and nobody's tried to do it since then. Whereas if the waiver were agreed to, compulsory licensing for export could be a much more easy initiative. So Canada could start ramping up its production and start selling to Rwanda and other African countries, and the Philippines maybe. So I think that the European model is an attempt to protect pharma from and protect the sort of neoliberal regime from the momentum which has been built up around the waiver. And I say don't let that momentum lapse, drive it home.
All right, so thank you for that, Dr. Leg, and thank you to all our speakers who discussed and shared their statements for today. So we will now proceed to an open forum. So for anyone who in our Zoom as well as in our Facebook Live who will be asking questions to our speakers, especially with regards to strengthening our resolve and strengthening our solidarity towards supporting the TRIPS waiver. So I'd like to invite all our speakers back if they're still here. Dr. Sacramento, Dr. Beg, Dr. Cagiat, Representative Zarate, I understand that Professor Sonido had to go ahead. No? So we have two questions. First, I'd like to start first with one of our questions on our Facebook chat, and that is from Professor Judy Tagiwalo, of also of Cure COVID. Uh, her question is, what made the U.S. Possibly change its position, and for it to suddenly now support the call for the TRIPS waiver? Is it an effect of people's demand, or is this something that is also political? And so, any of our speakers could answer. What do you think prompted the U.S. to suddenly shift 180 degrees towards supporting the TRIPS waiver?
Well, I could offer a suggestion. The Democrats aren't very fond of big pharma in the US because pharma has, over the years, through its use of lobbyists and electoral money, has achieved a situation whereby prices in the US are way above prices globally, which means that the Democrats who have promised universal health cover for the US are facing a major barrier, partly a political barrier from pharma, but also a financial barrier because of the price of medicines. So I think there is a strong feeling, particularly among the Democrats, that pharma has been given far too much leeway. I'm not sure about that, but that's my speculation.
Okay, thank you for that, Dr. Lek. Would any of our speakers also like to respond on what you think drove the U.S. to seeking to suddenly now supporting the TRIPS waiver from its old position?
May I give my personal inputs on this?
All right, go ahead, Simon.
Well, so I've been reading international politics. Tapos, I think personally, it's a political move by the US. I mean, these are my personal opinions. It's a political move by the US because there's currently a vaccines arms race, and there are many parties that are trying to portray themselves as the first ones who discovered the vaccine, the ones who contributed to the efforts. Particularly, they're in a war right now with China, who's also pushing their agenda. So I think it's a political move, personally, to make it seem that the US is pushing for equitable access to vaccines and reclaim their position in global politics as the perceived protector or provider in the international stage. That's my personal analysis of the situation. They wanna get back to that hero hero stance that they held before this whole global political war with China and other non-Western forces.
Right. So thank you, Simon. So it's also a political question. Right. So any other speakers would like to comment on that? Because if none, we'll move on to
Just
the
short, Doc Josh.
right. All right, go ahead, Congressman
I
Zarato.
certainly agree that this is a political move. No? It's not out of the benevolence of the U.S. to just suddenly it changes its position on the matter. I think, but we have to still give that a grain of salt, no, because we don't know yet. In the course of the negotiations, this could have been used only as a leverage, no, for the U.S. to get some advantage, especially in the course of the negotiation in the WTO. We don't know yet what particular provisions, at least from my readings, that they are supporting. What kind of waiver are they want to push to the limits, no? And what kinds of provisions that they want to keep, especially to prop up their so-called leadership in this war on producing effective vaccines. No? So at this point, well, it's a welcome development, but personally, I'm giving it, you know, a critical and look, no, and I'm not yet that convinced that eventually they will be all out unconditionally in supporting the call for of the people's vaccine. No? Not only, in fact, if I may suggest, you know, if they really wanted to help our people, especially in this times of pandemic, do not waive only on the issue of COVID-19 vaccine, but all the others, no? Because eventually this will truly help our people all over the world, especially in the poor countries. So that's my take on that, Dr. Josh. Thank you.
Right. All right. Thank you very much, Congressman Zarate. So that's really an important thing that the US has only mentioned a waiver for COVID-19 vaccines. Now they've actually haven't tackled the bigger aspect of the TRIPS waiver in covering everything from prevention, treatment, and containment of COVID-19. So we have a next question from Dr. Salvador Cavili. Right, Dr. Cavili, would you like to ask your question personally?
Yes. Can you hear me?
Yes.
Yes.
Yes, go
Yeah.
ahead.
Actually, what I would like to say is, I don't know. It's probably more of maybe more of a reaction than a question. I mean, I think that what's happened really is that we're suffering from decades of neglect. Basically, it's you can think of the trajectory of biomedical progress over the past maybe 200 to 300 years, and you'll see that until maybe shortly before the Second World War, a lot of what we were doing was actually in line with vaccines and immunological approaches using antibodies, antiserum. I mean, the old Alabang Serum Institute is probably a very good example of that. And then with the advent of antibiotics, so the sulfa drugs and then penicillins and all the others, that trajectory has been, you know, has gone off in this tangent that's led to like neglect of vaccines. And I can't help but, you know, imagine that it maybe it has to do with the business model of big pharma as a whole globally. What incentive does big pharma have to make vaccines that can protect people for years on end, if not for life, as opposed to making all these drugs that you have to take every so many hours for so many weeks or months or years or indefinitely? I mean, and this is not just about antibiotics. This is about all these maintenance medications. I mean, the whole idea of a pill for every ill, that you take as maintenance meds. So I think that if we really want to address this comprehensively, we'll have to revisit that whole process. So I mean, in advanced countries, people talk about the opioid crisis in the US and things like that. That's just emblematic of the whole system. It's it's the drug problem. It's not just the opioid problem. It's the dependence on maintenance meds rather than vaccines, antibodies, and other things that are more on the preventive side. That's just a thought that I wanted to share. Thank you very much.
Thank you very much, Dr. Kweli. So, of course, it's not just also the vaccines, but also basically the primary healthcare and the preventive services that are also hampering really the state of health in a lot of countries. Would anyone like to comment, Dr. Kagyat or Dr. Leg?
I would just like to add, so from the statement of Cure COVID, it's really yung who holds the technology, yung height of capitalism wherein really they have to to sell the products in order to rake in the maximum profits. So that has been what has dictated, especially in the Philippines, yung healthcare system of the Philippines. So we are really into the big, even now, no, the vaccine rollout is really dependent on private-public partnership, because our public healthcare system is really not at par, or not really at par, but something that we can be proud of, and really serving the public, or especially the poorest Filipinos. So it's the 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 issue is still for us, no, on how will you look at health as a commodity or as a public good that must be enjoyed by all uh, Filipinos equally, fairly, for all.
All right, thank you, Dr. Kayat. Dr. Lake?
Yeah, I like the distinction between vaccines and maintenance drugs, but it's worth remembering that since 2006, there's been a debate going on in the WHO about how to boost investment in drugs for diseases which particularly affect people in the developing world, and including vaccines. And it's very clear that that pharma makes much more profit from maintenance medicines, particularly if they've got price discretion over those medicines, than over once or twice a lifetime vaccinations. Pharma has fought with the support of the Americans and the Europeans against the development of a treaty which would be around the production of medicines and vaccines which are of particular need in the developing world. So again, the political significance of driving this waiver through to success is not just about COVID. It's about weakening the stranglehold that the extreme IP has over pharmaceutical production and access.
All right, thank you very much, Dr. Leg and Dr. Kogiat, for that. Okay. All right, so we have one more question. We're running out of time, but we have one last question from Dr. Carabeo. Dr. Carabeo, would you like me to just read this, or would you like to ask the question personally? Okay. His question is that what are the lessons from the successful campaigns on waiving TRIPS rules on HIV/AIDS medicines that we can utilize or even strengthen in our current campaign for the current TRIPS waiver? Is there anyone who would like to respond on what we can learn from the HIV/AIDS epidemic that we can apply now for our campaigns for COVID-19?
Yeah, the AIDS experience is huge and full of significance, including the role of people who are directly affected in getting in political advocacy, including the idea of treatment literacy, but above all, the development of transnational solidarity within the AIDS movement. And I think all of those have got huge significance for COVID and for the access to medicine struggle generally from here on.
Right. So, Dr. Carvea, did that answer your question? All right. Okay. So, we'll be concluding the open forum at this point. Before we conclude, would any of our speakers like to give their last words? We can start with Dr. Sacramento.
So as medical students, again, we are the future of not just this country, but of vaccine research, development, and of healthcare. And so, again, we assert our right to participate in this conversation. We assert our support for the TRIPS waiver. We support the position of local vaccine development and research, and we would like to support other future initiatives that aim to make healthcare more publicly accessible and more equitable, even if it stands in the face of current established systems such as neoliberalism, capitalism, and your current system that involves big pharma controlling your entire supply of medication and how it goes. So we would like to participate in the decisions that matter because after all, we are the future.
All right. Thank you, Dr. Sarmiento. Dr. Kagiat?
Hmm. I think siguro in reference also to the last question, I think the struggle for anything will rest on the strong solid movement, not only from uh, if we expect duty bearers to do that, but we have to influence them, and the strength will come from the rights holders, people from the community, those who are directly affected, and the ones with strength and actually the bearing to be able. They will be the ones to create the foundation for a strong movement to constantly challenge the monopoly of pharmaceutical companies and even states who would not support these movements, that will have a great impact on the public health or on the health of the people. So that's it for Cure COVID.
Thank you very much. In demanding accountability, from our communities. Right. Representative Zarate?
Thank you, Doc Joss. Siguro ang dagdag ko na lang, people's vaccine should be a struggle by the people themselves. No, it's as if people's call for waiver, people's call for unconditional support to these countries. But more importantly, we should make this a popular campaign among our people, because in the end, it will result to benefit or more suffering for our people. So kailangan kasama at pakikibaka ito ng mga mamayan. Want to achieve that goal of having a people's vaccine that will benefit for the people, by the people, and of the people. Maraming salamat, Dr. Jones.
Maraming salamat po, Kong Zarate. So, very important, very powerful words, na kailangan manggaling sa mamamayan. It's really the people's, If we really say that it is a people's vaccine or the people's right to health, then the people must be clamoring and actually fighting for what must be done in our healthcare system. Okay, and Dr. Leg, some final words?
The COVID pandemic throws up a range of challenges beyond the question of vaccines. And the one I'd like to sort of highlight is the role of industrial agriculture and the encroachment of human activity into natural spaces and the destruction of ecosystems, which lies behind the increasing frequency of epidemics, new pandemics, and that brings you face to face with transnational capitalism, and it's dependent on continued growth in basically everything. So we need to take the big picture as well as focusing on access to vaccines and medicines.
All right, thank you very much, Dr. Leg. Those have been our speakers, and really the fact that COVID-19 really reveals the bigger picture that we have often neglected, that we have often forgotten, that really people's health is not just about what is at hand, but really what has always been there in terms of the inequities and the structural violence that plague the people's health. Okay, so again, we would like to thank our speakers from the Coalition for People's Right to Health, the University of the Philippines Diliman COVID-19 Task Force through Chancellor Nemenzo and Professor Sunido, the Philippine Medical Students Association with Dr. Simon Sacramento, uh, the Cure COVID Network through Dr. Julie Cagiat, the Makabayan Bloc, Bayan Muna Party List through Congressman Zarate, and the People's Health Movement through Dr. David Legg. So with that, we'll be concluding this press briefing, but of course not before showing what will be our next steps after this. No, so definitely tomorrow will be the first day of the June 8 to 9 TRIPS Council meeting. And in light of that, again, still waiting for our official government position. The Coalition for People's Right to Health, Bantay Bakuna, the Council for Health and Development, and People's Health Movement Philippines will be writing to our Ambassador Manuel A. Tehanki, the permanent representative of the Philippines to the World Trade Organization in Geneva, Switzerland. No, we'll be writing a letter to our representative to the WTO to support the TRIPS waiver, and we are inviting everyone if you would join us, no, to in actually calling for the need for the Philippines to support this waiver together with the rest of our Southeast Asian neighbors, and really pushing a strong need, no, for the Philippines to increase its capacity and its healthcare system towards addressing not just this pandemic but even afterwards. No, so together with our signatories of the Coalition for People's Right to Health, the People's Health Movement Philippines, the Council for Health and Development, and Bantay Bakuna. So please message us if you would agree as well to add your names to this to the signatories and the organizations who are supporting this letter, to our permanent representative at the WTO who will be joining the discussions tomorrow. No? So hopefully the Philippines can have a strong stand in solidarity with the rest of the 62 countries proposing for the TRIPS waiver and the other countries supporting such a move for vaccine and health equity during and beyond this pandemic. Okay, so before we end, I'd like to call on some closing remarks from our from the People's Health Movement Philippines, our country coordinator, Dr. Delen de la Paz.
Thank you very much, Josh. And thank you to all our speakers who really contributed in clarifying many more of the points why we support the TRIPS waiver and endorsing the TRIPS waiver as a position of the people's organizations, the NGOs here in the country. And we really hope that our Philippine delegates, some of them have from the Department of Health signified their support, but they have not really come up with a more definitive statement that really shows that the Philippines is supporting the TRIPS waiver. So this letter that will be sent to Ambassador Tihanki hopefully would still be a catalyst that will ensure that the Philippines will also support the TRIPS waiver. But I just would like to summarize what has been discussed this morning. I'll just be sharing on my screen. So earlier, Josh has already flashed this. So the call for the Philippines is not to waiver on the TRIPS waiver, but support the TRIPS waiver now. The WTO Council is scheduled to meet tomorrow, June 8 and June 9. And we hope that there will be more countries that will be signifying their support. And this forum was entitled From Manila to Geneva and in Every Community. The end point is really, we need to uphold the people's right to health. We need to assert people over profit. We need to assert people over patents. And vaccines and health for the people should be given through a free comprehensive healthcare system. So it's not just looking at the vaccines per se, but looking beyond the vaccines at the comprehensive health system. So it has to be holistic. It has to really look at health as a right. And in this context where the vaccine is being discussed as a big pharma initiative, we should not really look at health as a commodity, and all other aspects of health should be seen in the context of a right. And we call upon individuals and organizations to endorse and support the TRIPS waiver and actively advocate with their governments for the adoption of the TRIPS waiver proposal. And eventually, when we talk of it, it's really the World Trade Organization has nothing to do with health. So WTO should be out of health. And this is what we have been harping on WHO, is that why did it allow that medicines be included in TRIPS? Why did it allow that many other health issues are included in a trade discussion rather than in a health and service discussion? So in the end, it's really, we need to address the overall social, economic, and political structure of society that will ensure health for all is possible. So we have to go back again and again to the principles of the Alma Ata Declaration on Primary Health Care, where definitely it is very clearly stated that health is a right, and health is the interplay of social, economic, political conditions. Without this development, without social and economic development, health is impossible to attain. And also looking at the social determinants of health, where we see that the environment, the conditions in society are the really influential areas on how we should improve health. And as Dr. Kawili has also mentioned, we have been so used to taking medicines when there are so many other aspects of development that need to be addressed. And Dr. Leg has also said that we have to look beyond this. We have to look also at industrial agribusiness that are contributing to the worsening of our environment and contributing to many more pathogens that will make pandemics and other illnesses possible again in the next few years. And everyone has mentioned that this is the issue is really very political, but we need the support of the people here, because in the end, it will be people who will take action for themselves. So what is very important in this endeavor is for us to continue educating the people, for us to continue informing the people what is happening, and for us to continue with harnessing the people's support. So a people's movement is really very important as we push for this TRIPS waiver. So it's not just the academe, it's not just the NGOs, but it's really the people who will bring this forward. So we thank everybody who contributed to this very informative and enlightening discussion, as well as we thank the speakers. Josh has already thanked all of you, but I'd like to say again, thank you to Professor Solido, to Simon, the pride of our next generation. So we really look upon the youth to move forward, to lead this movement for change, because eventually it will be you who will be taking over and also suffering from the effects of this wanton disrespect for our for our environment and the people's action. So we'd like to thank also Dr. Julie Kagiat from the Cure COVID, Representative Kaloy Zarate, Dr. David Legg from the People's Health Movement, and our the people in the audience who also contributed to the questions. So we thank everybody, and we really hope that this will carry on, even if WTO will not adopt this, but we will continue to push for this and enlighten people that big pharma, big business, and all the big countries that are dominating the rules in health should now be taken over by the people's rules for health and improvement of society. So again, on behalf of the Coalition for the People's Right to Health, Bantay Bakuna for Council for Health and Development, and People's Health Movement Philippines, we thank everyone and we wish us all the best in this endeavor. Thank you.
Okay, we'd like to end on this note, as mentioned by Dr. De La Paz earlier. So we call on the Philippine government not to waver on the waiver, to support the TRIPS waiver now, and to assert people over profit and patent. Okay, so before we end today's forum, again, we'd just like to thank the organizers of this event, uh, the Coalition for People's Right to Health, Bantay Bakuna, Council for Health and Development, and the People's Health Movement Philippines. And we'd like to especially thank our civic media partners, Now You Know and Rappler Move PH. So thank you everyone for listening in, and we hope to see your solidarity and your support towards the TRIPS waiver and the larger goal of upholding the right to health, people over patents and people over profits, with or without the pandemic. Thank you everyone, and keep safe, keep healthy.